Vinit. Vinit.
Shall we start, sir?
Yeah, please, sir.
Then, sir.
Yeah, please, sir.
Sir? Hello, sir?
Yes, madam.
Sony, it's audible. You can start now.
Sir, കേൾക്കാമോ?
Yes, yes. Kelkam.
Okay. Good morning, one and all. Myself, Sonia Nainan, most respected faculty members, research scholars, and dear students. Now, we are on the fourth day of our international conference on applications of computational clinical bioinformatics in pharmaceutical product development. It is a great pleasure for me to introduce our speaker, Dr. Kari V.V.S. Narayana Reddy, Faculty, Department of Pharmaceutics, JSS College of Pharmacy, Ooty, who is going to talk to us about the QBD approach in formulation development. Being a formulation scientist, this is a subject which we all are deeply interested. Dr. Kari V.V.S. Narayana Reddy has completed his PhD at the age of 29 years from JSS Academy of Higher Education and Research. He has received Inspire Fellow Award from DST for pursuing his PhD. His area of interest is on pharmaceutical nanotechnology in topical and transdermal drug delivery, cancer drug targeting, wound healing, and tissue engineering products. He has published more than 60 papers in reputed journals with a cumulative impact factor 87.27 with a citation of 350 plus and H index of 10. He has also written 6 book chapters for his credit. He is the co-principal investigator of the projects funded by DST, FIST, and DST Nano Mission. Presently is engaged in various consultancy works, including development of collagen-based drug delivery systems for diabetic wound healing. He has guided more than 30 UG and PG students. Currently, he is guiding 4 PhD scholars. He has been selected as question paper setter for GPAT examination 2019 and 20. He has delivered many invited lectures on topics QBD, DOE, publications, etc. He has been serving as a reviewer for 17 international journals. With this introduction, I welcome Doctor to begin the session.
Yeah.
Sir?
Yes, sir. Yes, madam. So thank you, Sonia, madam, for your wonderful introduction. So I request,
sir.
all the delegates, you please mute your mics, So most of the time when the speaker is in a full flow, sometimes you may not be doing it voluntarily. Sometimes you may be talking in the background and it will disturb the others. So just mute the mics. During the course of the presentation, if you have any doubts, I request you all, you put it on the chat box at the end of the presentation. I'll be very much happy to address that things, right? So before begin the session, I was very much thankful and to the grateful to the entire organizing committee, starting from the honorable patron, the manager, the respected administrator, convener, joint coordinators, and the core coordinators of the the main team of the organizing committee. I congratulate them for organizing the successful organizing of this webinar. So without any delay, I'm just starting my presentation. So once again, I'm requesting all the delegates, if any questions are there, please put it in the chat box. At the end of the session, we'll very much happy to discuss about that. And for the better viewing purposes, I'm just hiding my video, only my audio and my presentation only, you can able to see that. Okay, so I'll be assigned for the topics called as design of experiments and QBD. So for the today's session, I'll be taking only the DOE, and tomorrow's sessions I'll be continuing with the QBD. Why? Because I want to take first the design of experiment is the key integral element of the QBD is the design of experiments. So let us first focus on the design of experiments, then followed by the QBD for the tomorrow's session. So my intention to all the delegates is, nowadays, this picture, will show you why we're attending the webinars, most of the webinars. You can see nowadays all resumes are filled with, tens of pages. Before my resume only 5 pages. During this pandemic situation, my resume become 10 pages. So I'm requesting you and merging all the delegates, any workshop or, any intention of the webinar should not be for the certificate purpose, but it should be for the learning and updating the knowledge. Hope everybody will use this entire workshop, all the sessions starting from the 22nd to till 28th. And I hope you will be equipped with the knowledge, and this bag you will be filling with the knowledge rather than the certificates. I'm feeling hope, you will be doing the thing. And always remember, whatever it is, the way of the authors are delivering the sessions, it may be a webinars, it may be a through the physical presence. It's all depends on the individual, how you're using it. Doesn't matter how many resources you have, but if you don't know how to use them, it will be never be enough for you to use the resources. So I request everyone, you please make sure, the sessions you are using it and effectively you are learning from the subjects. And see, if you see all the sessions, if you could see the topics, and most of the topics are related to the formulation development. And these topics has been inspired from one of the syllabus called CAD. One of the subject in the M.Pharm pharmaceutics is called computer aided development. I hope, when the PCS introduced the syllabus, especially pharmaceutics domain is considered, this subject has, has made trouble, most of the people, because it's very new and it is a current topic, and many industries, what they're following in the pharmaceutical industry is the subject. So many people have expressed last couple of years, we are going to many colleges, maybe, more than 20, 30 colleges we have visited for the subject of CAD. Many people expressed, how to understand this subject. because whatever the subject, when there is a need, when it is new only, it is very difficult to learn, right? Because many other subject which you are learning, which is already old and we may be aware of it, but this CAD subject is very new and it is very thrust area for the industries and everybody have to know. So for that, what it is last, a couple of months, last 4 months during this pandemic situation, with the help of my co-authors, we have written a simplified textbook of computer and tech development, and it is ready to release to the entire India by the Valabha publishers. You may be knowing this Valabha Prakashan, where from your first B Farm we studied many pharmaceutics books like Pharmaceutics 1, Physical Pharmaceutics, Engineering, all the books we have been got from this Valabha Prakashan. So we have been tied up with them, and that book is ready to be released by the next month. Hope it will be useful for most of you. And here onwards, nobody may say the CAD is a very difficult subject. We have tried our level best to write in a very simplified manner. And even if you take the yesterday talks or today talks, and most of the related to this, subject called the computer drug development. Okay, let us begin with our presentation on today's topic, that is design of experiments. So before going to the topic, I would like to say that the views, the thoughts and information, opinions expressed in this presentation as belonging to solely to the presenter. That is me. Yes, once again, the mic is not muted. Please mute the mic. And not necessary to reflect the views from the literature book. Sometimes I may given some of the examples, because let us say design of experiments, why most of the people will feel it is very difficult. To escape from the statistics, on mathematics, we have come to the BPC, that is biology, physics, chemistry, we have taken in the +2 or PUC. So, okay, we came out to the UG, and UG also we have somehow we have followed with the biostatistics. Again, we come with somehow we have passed with the biostatistics subject. Again, when come to the PG, in the name of CAD, once again the statistics are following us in the name of DOI. So it is very difficult for the people to understand the mathematics and apply here. But if you see wherever the subject is understanding of mathematics, there is some part of mathematics will be very much required to proceed with the subject. So mathematics or this biostatistics is not so big difficult. I have tried to made in a very simplified way in the presentation. Of course, in many of the forums I have presented this. It is not a new thing which I'm presenting today. If already you have listened to the topic, definitely you can update with this current presentation, or else if you're a fresher, definitely you can make use of this presentation for your project purpose or whatever the future perspective which you're going to the industries. So what I want to say from this is, whatever the examples which are given, sometimes it is not maybe exactly the statistically related, but I have tried to to make you get into the brains which is very easily that examples I have taken. That's why it is not necessarily from the literature books. And further, I would like to say this presentation is purely made with a lot of example for student understanding purpose only, and it is never meant for any commercialization or any kind of marketing purposes. Okay. So with this brief thing, let us move on to the topic. So basically statistics, as I said in the beginning of this presentation, statistics are very important, especially when you concern with the design of experiments. Statistics is much more important to make the experiments with very familiar results. So when most technical professionals, like maybe the pharmacy professionals, express a mixture of fear, frustrated, and also annoyance. That means I don't want. So when confronted with the statistics, the moment they hear the term called statistics, they have this kind of expressions. So it is very hard even to pronounce the word, and many people, particularly after enduring the typical college lecture on the subject, they used to say instead of statistics, they used to call as statistics. But however, I would like to bring to your kind notice that statistics is not an evil. They're really very useful, especially for in the case of, let us say, today's seminar, the design of experiments. And see, when they say that the term called statistics, you don't need to learn complete textbook. Every topic, let us say, if today's topic design of experiments, there is few set of statistics if you learn, that is more than sufficient to interpret with the design of experiments. You know, once again, graduating in the statistics and getting PhD from the statistics. Very few things that in understandable way, if you can able to understand, that is more than enough for the learning of DOE. So just I will give you in 2 to 3 minutes the history of where the DOE started, where the statistics have started. Then we'll go to the actual topic. So at the beginning of 12th century, Sir Ronald Fisher introduced the concept of applying the statistical analysis during the planning stage of research rather than at the end of experimental. So what Sir Ronald Fisher said is, don't apply the statistics at the end. So what happens is, I don't know how many of you are aware of clinical trials. At the end of the clinical trials, they will do some statistical significance, the outcomes. The outcomes of the clinical trials, they'll say p-value at so and so, p-value at less than 0.05. Group 1 results is more significant than group 2, something like that. They'll apply some statistics, but instead of applying at the end of the at the end of the experimentation, if you could able to apply the statistics at the beginning of the experimentation, that will be more better reliable, the products you will get, the more better reliable experimentation you will get than that of applying at the end, is the opinion by the Sir Ronald Fisher. So when statistical thinking is applied from the design phase, it enables building a quality in the product. That's concept we are saying is quality by design. So at the beginning of the experimentation, if you could able to apply the statistics, you can able to get a better product than applying and otherwise cracking the brain at the end of the product. So what has happened to the pharmaceutical design? Why we are only talking about DOE? Is really DOE is a new term, or it was established very long back? Let us see. The pharmaceutical industry was very late in adopting these paradigms compared to other sectors like engineering. So what happened is, it is heavily focused on blockbuster drugs. What is the meaning of blockbuster drugs? Like blockbuster movie. What is the meaning of a blockbuster movie is, if a movie is earning more money and it is running for 100 days, we are calling as blockbuster movie. Money is involved, that means profits. So why pharmaceutical companies are more involved in chemistry or the blockbuster drugs is, if they get patent for a new drug, they can able to earn for the next 20 years the money, in a huge manner. But if you apply DOE, that doesn't matter much for them. See, without DOE or without QBD also, they can able to prepare the product. That is not a big deal. But the money, if they want to get it in a huge manner, they are concentrating on the blockbuster drugs. That is a new drugs. Let us say recently cancer drugs. If you take a paracetamol, you'll get for 1 rupee. Have you get the cancer drugs for 1 rupee? No, because it is a patented drug. They have to earn the money which they invested for the last, couple of decades or the couple of years or whatever it is. So usually our pharmaceutical industry was concentrated on blockbuster drugs, but now they cannot no more do this thing, because all regulations, including the FDA, was insisting every pharmaceutical company to concentrate now on the quality-based design of, quality-based design development of the product, rather than just like that using OFAT experiments to develop a product. So what I want to say is, the blockbuster drug era is gone now. Now the pharmaceutical industry is highly focused in developing a quality-based products, because all regulatory agencies insisting to do the same. So let us move on to the OFAT experiments. So first you understand what is OFAT experiment, then we'll move on to the design of experiments, why this design of experiment came. And what now till all the people, including your region PG, what you exactly did. Let us say a teacher has asked the B.Pharm students who's doing practical, other as an M.Pharm students who are doing a practical, prepare and submit albendazole tablets. You know what is the purpose of albendazole? Antihelminthic drug, each containing the dose of 100 mg albendazole, right? I'm saying is a general example. When a teacher asked the group of people, an individual, student in the PG or UG, they asked, a student has asked, like, how you're preparing a tablets, going to the punching machine and punching a tablet, just mixing something, right? Without understanding the reason, what is excipient, what for using, all those things. So what they'll do is, usually the student will put a table like this, the batch code, drug, what is excipients, and these are the excipients, drug and excipients, and these are the responses which you have to measure, like hardness, disintegration, friability, and dissolution, by putting a table like this. And you're putting the terms like B1, batch 1, batch 2, batch 3, or you're writing F1, F2, F3, and some other names, whatever is feasible to you, you're writing it. And the drug remains same, because the dose cannot be changed. It is 100 mg. So our only thing you're varying the concentration of excipient. Let us say V cell, which is ranging from around near about 12 to highest around 20. Okay. Similarly, magnesium stearate and calcium, carboxymethyl cellulose and starch you are using, and you are measuring the responses like hardness, disintegration, friability, and dissolution. So the student will bring the reports. Suddenly he will bring the reports all of you one day. Sir, I have finished my experimentation. I prepared the albendazole tablet. B5 is the best batch, sir. B5 is the best batch. So the teacher is asking how it is the best batch. He's saying, I got the maximum dissolution, sir, for this batch. Okay. It is fine, absolutely fine. Now that you are having a better resolution, it is fine. Now is the way, first of all, to teacher ask the student to prepare and submit albendazole tablet, point number 1. Point number 2 is the right way student is doing the practical and bringing in the results. Is it 89% is a good batch? Okay. If 89% is really good batch, how we got 89%? What made the drug to be released in 89% in not less than 15 minutes or whatever it is? So what is the logic behind that? What ingredient is majorly playing the resolution? Okay, but FDA will not ask like that. FDA will ask US FDA, and when you're submitting a product, we want a tablet which is having a dissolution not less than 85%, 85%, not less than 85% in the matter of 5 minutes. So now the same task you just give to student. That means you're asking me prepare a tablet. Now you want a dissolution exactly 85% and should release within 15 minutes. Now do you think really this 10 batches is sufficient for him to get this 85%? Definitely no, because these are called as trial and error. These are called as trial and error batches. That means you are keep on preparing something until you are getting the result. Right? See, the student is preparing so many batches. I'm showing here 10. Sometimes it may be 15. Sometimes it may be 20. Until he's getting the result which is required. Here he said 89%, but 89% is not the correct result. I want the release within less than 55 minutes, and the dissolution should be 85%. But if I give the same test to the students, he may have to prepare some 50 tablets, 60 tablets until he's getting 85%. Okay. At the 50th batch, he got 85%. Somehow he got it. But the question is again, is it repeatable? Now, that means once again, when the student take all the ingredients of the 50th batch, do you think the student will get 50% again? Is that any repeatability is there? So these are all the questions and the problems associated with the term called OFAT, one factor at a time. That means in the entire experimentation, if you could observe or not, only you are changing one factor at a time. That means in this experiment, you are changing AV cell concentration. In this experiment, you are putting all constant and changing only magnesium stearate. And the other experiment, you are varying another term. That means you are varying one factor at a time to see what has happened to the result. But this is not the right way to do it. So the right way to do it, you can able to correlate. That means when you change AV cell concentration, what happens to my dissolution? When I change magnesium stearate concentration, what happens to my dissolution? That means the correlation between the excipients and that of responses will be very much required when you want to develop a quality by design product. So that is what what is the meaning of quality is. Now the quality is in your hands. Here quality is nothing but the shining or the color. The quality is nothing but the response. See, if dissolution fails, then the entire product is going to be wasted. So dissolution I'm talking as quality. The quality of this tablet I can say by measuring the dissolution, we should be 85% in not less than 5 minutes. So if this tablet, if the albendazole tablet can able to release 85% of albendazole in not less than 15 minutes, then I can say it is a quality product. But obviously, where is my quality relied on? On my parameters, which I'm taking the starch concentration, the carbon, the CMC concentration, the magnesium stearate, and the AV cell concentration. In all this concentration, it has been relied. Now, what is the purpose of DO is, if we can able to correlate the excipients or otherwise the factors which you are taking with respect to responses, and if we can able to know if I change which factor, then I can be able to get 85%, then the quality is in your hand, and the topic is called as design of experiments. Please try to understand. Once again, I'm saying OFAT experiments are just experiment. You are changing one factor at a time. So you cannot know what exactly happening to the responses. You are only relying on trial and error. Which batch is coming a good result, you are seeing that. But that is not the way, because tomorrow somebody asks to repeat you and you will not get the same result. And there is no correlation also. So you can see this table to understand better what is the difference between OFAT and DO is. In OFAT, you require more number of trials or runs, isn't it? It may be 50, it may be 60, it may be 70, until you are getting the desired result. That is 85% release, you should do it. But whereas in the DO, it is not the case. The less number of runs, also called as fixed number of runs. DOI has set a number of models starting from factorialism to response surface design. Fixed number of designs will have fixed number of runs. Each run, let us say factorialism, if you take 2 factors, you will get 4 runs. If you take 3 factors, you will get 8 runs. So the less number of runs, within the fixed number of runs, you will get the desired results. Whereas in the case of OFAT experiments, there is no limit. You keep on doing the experiment until you will get the results. The second point is the number of runs depend upon the output product. Yes. So output product, how much percentage it is giving? Unless until it is giving the 85% release, you keep on doing it. But whereas fixed number of runs is based upon the design, the design which you are using, the number of runs will be fixed. It is a classical type, that is nothing but very traditional type. By changing one factor at a time, or we also called as OVAT, you are changing one variable at a time, that is the one concentration or one excipient at a time. It is a scientific, that means having some logic, study and the correlation of all the factors with the responses. You are correlating each and factor, how it is influencing the response. Here consideration of all factors are equal. That's why in each and every experiment you are changing the variables, invariably without knowing what they're doing it. You are thinking it's a blind experiment. We don't know what experiment, how it is influencing the resolution. But here in the case, you are having a relative significance of each factor. That means each factor, how much level it is going to influence, each factor, how much going to influence the response like resolution, you are going to see it. Here you cannot see no interactions. What is the meaning of interaction is, let us say in a tablet, you are taking cross caramelized sodium and you are taking magnesium stearate. So as a formulator, you know what is the purpose of this two. This is a super disintegrant. That means a burst release. It is a super disintegrant. But whereas magnesium stearate is a lubricant for easy ejection of the tablet. Now, what is our assumption if it is a OFAT experiment? Okay, cross caramelase will disintegrate my tablet. Magnesium stearate will lubricate my tablet, right? But this is not the concept. I don't know how many of you are aware, magnesium stearate will also interfere with the dissolution. Because we know the direct relation is, it is influencing with the disintegration. Disintegration will be followed by the dissolution. That is how we are correlating. And what you are thinking is magnesium stearate is a lubricant. It is not related to the dissolution. No, but that is not the case, because magnesium stearate will interfere with the dissolution by forming magnesium stearate adducts. If you have, after this presentation, you can search the literature. In most of the tablets, magnesium stearate will interfere by forming the magnesium stearate adducts and thereby dissolution. So what is the OFAT experiment assumption is, okay, magnesium stearate is only lubricant. But in the case of DY, DY will tell you each and every factor. It will consider all factor significant influence on the response. It will also say magnesium stearate is influencing the dissolution. The term I'm saying is called as interaction. That means magnesium stearate is interacting with the dissolution. Please try to understand. Cross caramelized sodium work is for the super disintegrate and dissolution, but magnesium stearate is interfering this. That means it is interacting here with the process of dissolution. That is called as interaction. But in the case of OFAT experiment, that kind of observations we cannot do it, because we are only relying on the final result, that is the outcome, how much release it is. But whereas in the case of DOA experiments, we can able to see the interactions, how one excipient is interacting with the response of other excipients. Try to understand. It is not the chemical interaction. That is, cross caramelized sodium is not chemically interacting with the magnesium stearate. Don't think like that. Because before doing the tablet, you are doing pre-formulation studies. There itself, you are finding any chemical interaction, that is called as incompatibility is there between or not. But this interaction is called interaction the response. That means it is stopping the cross caramelized sodium work. What is the cross caramelized sodium work? Super disintegration, thereby dissolution. But magnesium stearate is also influencing the dissolution apart from the lubricant. That is called as interaction effects. Interaction effects can be better studied here. Okay, the next point is, if any experiment fails, the rest will be unassured. That means if one experiment failed, we have to go to the next experiment failed, you have to go to the another. So it is like each and everything is not correlated, is unassured, but it is not like that. It is predictive and decision. That means the first run will be linked with the second run linked with the third run, and each and every run in the design of experiments are correlated with each other. So less knowledge from the experiment. Because why there is less knowledge? Here you are not studying individual experiment influence on the response. But whereas in the case of design experiment, each factor influence the significance, you are studying with the what happened to the response. Each you are correlating. That's why you are having knowledge what is happening to the magnesium stearate, what happens when a cross caramelized sodium is increasing or decreasing. So each and every factor you have a knowledge what was happening to the dissolution. So you have to use maximum resources at times. Since the number of experiments is infinity, you have to keep on doing until the experiments gives the good results. So you have to use the time, you have to use so many chemicals, you have to use so much of resources. But here is case of minimum resources, because the number of runs are fixed number of resources. So inaccurate information, because you are only relying on any one experiment which is giving good results. Accurate information, because you know each and every factor in the experiment, you know how it is influencing the response. Sometimes misleading results, prediction on the process of behavior within the space. Sometimes products are subjects to failure. What is the meaning of this failure is, you may have here the terms called recalls. You may have the term called recalls. Most of the regulatory agencies, after your product has been successfully launched to the market, they will say there is a recall for your product. I will show some example here. We just put in the Google FDA recalls. Okay. Just a minute, is loading. You can see here there are n number of products. What is the product for? What is the product type, and why it has been recalled? Let us say you take yes. You take SCA Pharma. This is an heparin sodium compounded products. It is basically a drug. Incorrect preservative. There is some problem with the preservation, and they are saying the above product, some microbial contamination is happening after launching into market. And even if you know, the recent FDA recalls is mainly due to the sanitizers. Because of this COVID-19, many sanitizers has been into the market, but they said there have been these people, since methanol is getting very cheaply, they have been contaminating with methanol rather than ethanol to be used. So like that, many recalls will be getting by the manufacturers from the regulatory agencies. And one of the prime most reason for this recalls is due to the lack of quality of the product. Sometimes, okay, we are agreeing that manufacturer is voluntarily doing the mistakes. Sometimes it is not in the hands. Let us say microbial contamination. Manufacturers correctly checked only. At the end of the product, he checked the microbial contamination. It is within the limits of the prescribing, within the limits prescribed by the regulatory agencies. But he don't know why this microbial contamination happened, because he didn't use the quality by design approach, because he don't know what factor which he used in the product which is causing this contamination during the marketing. That is what I want to emphasize here. DOE is, it will tell you each and every factor, which and every excipient, how is influencing the final product. But in the case of OFAT experiments, you cannot know. It is like a blind study. You are adding the excipient based upon your knowledge, and you are getting the product. But DOE is not the case. Each and every factor influence will be studied individually. That can be also interpret how the product quality will be correlated with the each and every factor. So, okay. So finally, why DOE? At least you can able to understand now, to find out the optimum formulation and optimization of experiments. So that is what range the excipient can be used to get the better results, and to find out if changes are made, you know, SUPEX, scale up and post approval changes. Sometimes we may have to change the plant. Sometimes we have to change the manufacturing equipment, site, everything. That time we may not get 85% once again. You will get different results. So if I made some changes, what happens to my outcome? That also can be easily correlated if you know what is the factors and their influence on the responses. So to study the effect of critical material attributes and critical process parameters on critical quality attributes. These terms you are going to see tomorrow on the quality by design. These are the terms from the quality by design. Material attributes means the attributes, the properties related to the excipients, the materials. The process parameters means what is the process parameters, originally compression speed and the ejection speed of the tablet, and the maybe the roller compression space. There are many parameters, process parameters involved during the preparation of any dosage form. So you can able to study. Simply I can say for the today's presentation, this two is nothing but the excipients range and their influence on the quality attributes, nothing but dissolution, disintegration, or friability, or whatever we can say. These are all quality of the product. It determines the quality of the product. You can able to see their excipients and their concentrations and what is their effect on the quality, that can able to correlate. And obviously, to save the time, to reduce the cost and get the most reliable, robust product is the uses of the DOE. So just I will show a glance who are working in the UG, PG and even a faculty, how important the DO is, especially to the pharmaceutical sector, and as a researcher, how important it is. When you take a Scopus search with the keywords called design of experiment, I said design of experiment is not only the son of the pharmaceutical domain. It is a very vast domain. Now only pharmaceutical people are using this term. Okay, so you can see the search terminology when we put in the Scopus search design of experiments on pharmaceutical in the 1991, we can able to see only 10 articles. And when the year passes 2000, in the year of 2029 articles, 2005 24 articles, and 2010 around 281 articles. In the 2019 only around 500 plus articles. That means it is very primitive stage. It is in budding stage. So once you can able to apply in your PG and PhD projects the design of experiments, you will be having a better publication and easy publication with the domain, because you are regularly preparing the product. We are saying no, but you are preparing a product, or you are doing some synthesis. By applying DOE, you are getting a reliable product. That means the product which is validated. Okay, that means there is a correlation. So that is what now scientific domain is nowadays expecting from every article, whether you have used the design of experiment approach to synthesize a new compound, otherwise to manufacture a product, and what is the variations you have seen, what is the excipients you have taken, how it is influencing the responses which you have taken. All this data nowadays they want, and if you know this, and if you can able to apply this in your career, and definitely you will be having better publication, easier publication, rather than having more rejection from the journals. Okay, so let us move on to the topic without delaying further more time. So before going to the the actual topic, as I said, the statistics is the basics for any kind of experimentations like DOE. So we should know some statistics before entering into the DOE. So for the DOE is concerned, there are 4 terminologies which is very much important that one has to understand. Otherwise, whatever the conference you attend on DOE and QBD, you will be coming out without knowing anything. I'm sure, very much sure about it. This is the problem many people have faced when we went to many colleges. The problem is the industry experts, when you call, he will be explaining very nicely, how we have to do the DOE experimentation. I'm not saying no, but because he may be working from the last 10 years in the DOE and he is able to interpret nicely and he can able to tell you. But the problem is, as a fresher, if you are not knowing the concept, the basic concept of DOE, and once you are seeing directly with the presentation of the experts, you cannot understand anything. You'll be after 2-3 minutes, you'll be become blank and you'll be leaving the presentation. So always the basics is very important before going to any kind of topic. So for the DOE is concerned, and especially the statistics in the DOE is concerned, there are 4 important statistics which is very important are the null hypothesis and alternate hypothesis, the p-value, the f-test, ANOVA, and half normality plots. These are the few things, if you could understand, you can very easily interpret the design of experiments. So let us move to the null hypothesis. So one can able to see here, there are 100 swans are there. There are 100 swans are there. Now in this, how many white swans or how many black swans you count it? Okay. So simple way to do this is you just count the black swans, which is around 6. So obviously remaining 94 is white swans. Now somebody asked a question, a layman, is the population of 100 swans, in the population of 100 swans, is the white swans population is significant number than black swans? Okay, I hope you understand the question. I'm using the term, please try to understand. Is the white swans population is significant to the black swans population? Is my question. What happens is, as a layman, including if I'm a layman, what I'll tell, of course, yeah, because see, when 94 white swans are there, only 6 black swans are there, yes, the number is significant, right? That is the layman perception. But scientifically it is correct. Statistically it is correct, because we have to use some statistical terminology to say whether a significant difference is there or not. I'll tell you one of our scientific example. Let us say I have 2 tablets, immediate release, paracetamol, immediate release tablet. Now this is prepared in your pharmaceutics lab. Okay, you got somewhere around 86% release in 15 minutes. I have the tablet which I bought from market. When I do the resolution, I got somewhere around 83. Now what student will think in the mind, sir, what is there, sir? Only 3% only deviation now. But who knows, this 3% may be a significant deviation It will cause many pharmacological effects. That 3% deviation alone may cause any pharmacological effects. Now, as a layman, we should never talk like this, that 3% is more or less. We should use always some scientific or statistical tools to say the significant difference is there or not. That is very important. Okay, let us say, I will tell you another example to say, let us say cross caramelized sodium. Just now I'm saying the before slide, which is a super disintegrant, which I taken in the experimentation 5 as the least level and 15 as the highest level. And now I'm doing experimentation by taking 5 mg in one tablet, 10 mg in one tablet, 15 mg one tablet. Now I'm getting a disintegration time, 10 minutes, 9 minutes, 8 minutes. So somebody as a layman point of view, it shows, sir, what is there, sir? When I'm increasing the cross caramelized sodium concentration, the disintegration time is decreasing. It's okay now. But my question is this significant? Is it okay like this? Because the cross caramelized nature is super disintegrant. And obviously, when you increase the concentration of cross caramelized sodium, obviously the disintegration time will be reducing. But is it significantly reducing or not? One has to be verified. For there, where you can use the concept of null hypothesis or alternate hypothesis. But okay, let us come back to the swans. Our swans, 96 white swans, 4 black swans. Now, as per the null hypothesis, they says there is no significant difference between these two. All are equal. Sir, what is it, sir? You just now we are discussing like, there is more white swans than black swans. But statistically, you cannot tell, since you are looking more white swans than black swans. You should use some statistical terminology. That's why I said you have to use some hypothesis called like null hypothesis. What is a null hypothesis and alternate hypothesis says when the population is more than 95% and above. Try to understand. When the value is 95% and above, you can say it is significant number. Let us see this one. Here you can see white swans were 95, whereas the black swans are 5. Now in this population, 95% are white swans, then 5% are black swans. That means now your confidence level is 95%. Now you can able to reject the null hypothesis, which says there is no significant difference. Now you confidently says, sir, yes, my white swan population is excellent, 95%. Than the black swans, because you fixed a value of 95%. That is called alternative hypothesis. Unless until you are having a confidence of 95%, you cannot say significant. Still, if you don't understand this concept, I can say a simple example. One student is talking with other student and is discussing about the exams. What happened is this fellow didn't prepare for the exams for the tomorrow sessional exam. But we want to do one day batting. Just another 5 hours is there. You want to prepare for it. Now the student is asking this fellow, are you sure? Are you confident that you can pass tomorrow exam? Now, if this student will say, yes, my confidence levels is 95%, definitely will pass the exam because this is a significant level. But if his confidence is 94% or 93%, maybe or may not he pass. I am not saying it definitely will fail, but the confidence is not sufficient, not significant to tell, yes, I may pass the exam. That is the concept of null hypothesis or alternate hypothesis. Null hypothesis says there is no significant difference between those two. All are equal. Once you want to say I have a significance, I have a confidence level, your confidence level should be 95% and above. That is nothing but alternative hypothesis. The confidence level is enough to say that you have better results. Similarly, when you take some excipients, when you are saying the range of 5 to 15, which is shown here, whether really there is a significant difference between the disintegration of, let us say, 10 to 5, whether this range is really significant, then you can say, yes, the range which is selected is very much confident that which will vary my super disintegration power. Anyway, during the experimentation example, you can better understand this, what I'm saying in the examples. So that is about the null hypothesis or alternate hypothesis. Based upon this only, the confidence interval, many of you heard about this term called confidence interval. This has been designed. So if we say 95% and above or less than 5%, both are same. I'll tell you how. So 95 by out of 100, say out of 100 swans, 95% confidence means the value is 0.95. I will express this in another way. How I will express is in the matter of 5%. 5 divided by 100 is 0.05. Right? P value. I'm using this term as P value, probability value. Or still my confidence is more. That means 99%. It's very nice. That means I have 99 white swans, only one black swan. So obviously this side what happens? 1%. So 1 divided by 100 is 0.01, which you are seeing here. Still you are more confident, 99.9%, then it becomes 0.01. So 1 divided by 0.01, what happens is obviously it becomes 0.001. So what I would like to say is, please don't confuse. Either you can say in the confidence levels of 95%, or you can push this way. You are increasing this means obviously you are decreasing this one. You are decreasing this one means obviously P value will be getting down. You can see many of the articles, they will be mentioning the P value, but that time you will confuse what is the 0.05, 0.0 and all those things. It is nothing but indirectly it was talking about your confidence level only. As the P value decreases, indirectly says your confidence level is increasing. At the P value of 0.05 means yes, you are confident at 95%. At the P value of 0.01 means yes, you are confident at 99%. And 0.01 means 99.9%. This will obviously linking with the confidence intervals only. It says how confident you are, how confident with your factor you are, and how much it is influencing the response. Okay. So this comes to the another statistical tool called ANOVA. Basically, two types of ANOVAs are there: one-way ANOVA and two-way ANOVA. The simple logic is, if you are having one variable or one factor or one excipient, that is called as one-way ANOVA. And if you are having two excipients or two variables, that is called as two-way ANOVA. You can see the example. I am taking dissolution as a response here in the y-axis. I want to study the solid state, one factor. This is one factor. The solid state of the albendazole, if I am taking, what is the dissolution? You have studied in the physical pharmaceutics. Solid state is like two types. One is crystalline, amorphous, and polymorphs. Crystalline solids having less solubility, amorphous having more solubility, and you want to study what is the dissolution profile. When there is more solubility, obviously the dissolution also more. That is one way ANOVA or one variable. Now we are talking about two way ANOVA. Once again, solid state and the granulation technique. So for the preparation of same albendazole tablet, I am taking wet granulation, I am doing dry granulation, I am doing melt granulation techniques. So wet granulation is giving more dissolution. So obviously what I am doing is I am just studying each and every factor which I am taking, what is its effect on dissolution. Now that is about one way and two way ANOVA. Now the question is, if you take any tablet or if you take any pharmaceutical product development, we have n number of variables. There is no only one variable. There is so many variables are there. Then what is the statistical tool we are having to do that? Because have you had any time called as three-way ANOVA? You may never had this term called three-way ANOVA, because in graphically we can able to show only, this is called a standard deviation, x-axis, y-axis. Okay, when you are interpreting something, you have standard deviation here. Let us say I have two variables. How I can show is in the same graph. One I will show on the upper side, another thing I will show on the lower side. That is called as two ANOVA. But graphically, you cannot show. See, yes, somebody, Rajesh Chan, I think you are sharing the screen. Please off it. Okay, but graphically you cannot show more than two variables. That is why more than two-way ANOVA, there is term called as no term called three-way ANOVA, four-way ANOVA. Now, but in the formulation we have n number of variables. Then how to do it? Then it is called as multiple variables. We are calling as multiple variable ANOVA, also called as, please try to understand my dear delegates, it is called as DOE. DOE is nothing but having more than two variables or two ANOVA, that is called as multiple ANOVA. That means n number of variables you take it. If you are clubbing all together into a single experiment, that is called as DOE also. That's why DOE having another name called as multiple variable ANOVA. That means you are taking more than two variables and correlating with the responses. So that is called as the multiple variable ANOVA or DOE. And F-test also is once again related with the ANOVA. We will be talking F-test when you are doing this experimentation. Then comes to the off normality plot. So off normality plot are basically we are getting from the normality plot. So what is this normality, off normality? Once again, when there is an experimentation, that time we will see about this. So what is the use of this graph is, you can see here all the factors which you have taken for the preparation of a tablet has been divided into two areas. One is falling above or below the graph, and others are falling on the axis, on the line, right? That means all the factors, there are 10 factors, let us say, have taken, you have been divided into two types: the factors which is falling above or below the line, the factors which is falling on the line. So what is the advantage or what is the use of this graph is, we can able to say the factors which is falling on the graph are non-significant factors. That means they are not influencing the dissolution. The factors which is falling above or below this graph are called as significant factors. That is, they're influencing the dissolution. So basically the off normality plot is a graphical tool that uses the orderly estimate effects and helps in assessing the important factors with that of unimportant factors, also called as significant factors with that of non-significant factors. So I want to say one thing for the DOI is, you please don't estimate the DOI will give you an ideal run. Like, you have seen before on table albendazole, B5 is the ideal tablet, but DOI will never say it is an ideal batch or unideal batch. It will create a design space. That means a set of range of experiments where you can able to work within this space. If you work, there is no deviation. Let us say, if you keep this is an ideal design space which is created with the DOI. If you keep the cursor like this, it will be definitely 85% and above dissolution. It will not be definitely less than 80%, 85% below. That means within this range you can able to work and you will get definitely not less than 85% release. So DOI will always give the design space, but it will never give a ideal formula. So before looking into the, okay, then let us finish the terms, then we'll have some interaction, what are the doubts we'll be having until now. Let me finish the terms. So before entering into the actual designs or the design of experimentation, you should understand the terms, because we are not using the regular terms. Because as I said, the DOI is a vast area. Everybody using many people are using, many sectors are using the design of experiments. So there is a common terminology and we can able to see how we can able to correlate with this. The first terminology is called as input variable. In QBD terms, this is also called as critical meter attributes or critical process parameters. So these are the input variables that can be changed. Let us say example like excipients and their concentrations, and also sometimes they may interact, which you've seen in the previous slides. I have shown like cross-carbonyl sodium and magnesium stearate, how they're interacting with the dissolution. So they may interact, or sometimes they may not interact with each other. We should understand input variables are nothing but excipients and their concentrations. Sometimes they may interact or sometimes they may not interact. Also called as, see how many terms they're using, because this is the problem where most of the people is confusing. When they read articles or then they read some books, they'll always confuse. Sometimes they're using input variables, sometimes they're using factor, cause, effect. But remember, always in the lifetime, input variable is also called as a factor, also called as cause. Why we are calling as cause? It is doing some effect. What is the effect? It is producing some response, right? And also called as independent variable. That means it assures that cross-carbonyl sodium is not depending with anyone to produce the super disintegration effect, right? It is an independent factor. It is working independently to show its effect. That is what called as independent factor. So once again, I'm repeating, these are also called as input variables, also called as factors, also called as cause, because it is showing some effect. Let us say cross-carbonyl sodium is a cause for the super disintegration, and also it is called as independent variable. The examples which are given here, the type and concentration of ingredients such as polymer which you are taking, bindery you are taking, or whatever the ingredients you are taking, their concentrations are the best examples of input variables. The next comes to the output variables, also called as critical quality attributes. That means these are the things, nothing but your responses. Response is nothing but, as I said in the beginning of the presentation, these are the quality aspects of the product. These are the quality aspects of the products like dissolution, disintegration, or whatever it is. So these are also can be called as the results or output value. Like you are saying as an input variable, we can call it as output value. You can also call it as result. You can also call it as response. And also we are calling as dependent variable. This is called as dependent variable. Why it is dependent variable? Because it is depending on the independent variable. let us say disintegration, which is a output variable depending on the input variable cross carbonyl sodium. That's why it is called as dependent variable, also called as response, also called as effect, because it is the effect by the cause here, right? Hope you are familiar with the terms now. This is also called as output variables, also called as a result, also called as a response, also called as effect, also called as a dependent variable. So these are the terms why this came. Just now I explained to you. The examples are like disintegration time, hardness, SA, dissolution. That is whatever the responses you are measuring for any dosage form, that all will comes here. Just a minute. Okay. Next, the next comes to the levels. So what is the meaning of level is, once you could recall back, I'm just going as a glance 1 minute. Slide number. Yeah. Okay. Yes. So what is the meaning of level is, you take the AV cell pH here, the input variable. Okay, here onwards, no, the delegates, please understand, I am not using the terms which is related to the pharmaceutical sector. Let us use the terms related to the DOE, which is called as input variable. These are called as output variables, also called as responses. These are the input variables. Now I'm talking about the levels. The levels are related to only input variables. So let us say here, what is the least concentration? 12. What is the highest concentration? 10. So this is the low level. This is the high level. This is the low level. So in the scientific manner, how they're representing is symbol minus. Minus indicates the low level, plus indicates the highest level. Please concentrate here, because the rest of the slides, plus and minus will be repeated in many places. You should not confuse. Minus indicates low level, plus indicates the highest level of the ingredient, or the whatever. If let us say, let us talk about the tablet compression force 15 and 10. This is the least compression force you are using. This is the highest compression force you are using. So this will be the minus, and this will be the plus. Now what is the intermediate between these two? 12.5, and this is the mid level. Mid level with the symbol 0. So there are 3 levels: minus, plus, and 0. Minus is the least level which you are taking, the least concentration. The plus level is the highest concentration, and 0 is the mid level for this both. That is called as levels. Okay, so low level is minus, medium level is 0, plus level is 0.1. Next talks about axial points. These are the special levels which is applicable for the design called as central composite design. These are also called as star points. These are represented with the symbol alpha. Okay, these are the special levels which is neither minus, neither plus or 0. It is beyond the plus, minus, and 0. So when I'm discussing about the CCD level, CCD design, this CCD design development, I will tell you these levels, how it is going to become. Okay, the next is the effect. This is already we have seen the output or response. See, please don't think anything as a scientifically. These are all nothing but your simple y is equal to mx plus c. Y is the response. Let us say disintegration or dissolution, also called as effect. X is the factor which you are taking. You know already the factor which you are taking on the concentration of the factor is depending by the y. The y is depending on the concentration of x. This is a simple equation of y is equal to mx plus c. X is the factor and y is the response. That is why we are studying in the DOE. But what is the advantage of DOE is you are studying n number of factors. This is alpha. Many factors will be there, not only one factor. Like in the 2 ANOVA, you can have x, you can have x1. But I'm saying in the DO, you can study x alpha, n number of factors you can study parallelly to see these effects on disintegration and dissolution at a time, especially at significant level effects. That is called the effect. Okay. There is another term called uncontrolled factors, which is not necessary to be discussed in pharmaceutical sector. These are also called as noise factors, which cannot be avoided during the experimentation. Let us say if we take an engineering experiments, the heat generated during the machine development that cannot be avoided. So they will say this is called as noise factors that will be studied along with the other factors that will not consider as the thing. Okay. So let us have some discussion, then we can come back, to resume the presentation. Yes, any doubts? Until now, whatever you have said?
Hello, sir. Can you hear?
Yes, Danish, sir, please.
Can you explain once again the importance of half normality plot?
Yes. So apart from this, any other question, I'll take all together at a time. Okay, I have one more question in the chat box. Okay, let me come back. Okay, let us take a graph. X and Y. Okay. Now, I am studying dissolution as a response. Let us take my formula of albendazole. Drug plus excipients. I'm talking like talcum powder. I have used cross caramelized sodium. I have used magnesium stearate. What else is there? Let us say, sorry. Okay, this is the end, I think. Okay, magnesium stearate. Then I have used some diluent and some other things. Now, as a formulation scientist, you may be knowing which one is really influencing the dissolution. I can say cross caramelized sodium because it is a super disintegrant, because unless until there is a disintegration, there is no dissolution. And as I mentioned before, magnesium stearate is obstructing the dissolution. See, it is a positive or negative effect that may be definitely is influencing. It is not necessary to be a positive effect. It is stopping the dissolution. Whereas if you take talcum powder, which is a glidant, it is nowhere related to the dissolution. It is related to the flow properties. And diluent, whatever you are adding to make up the volume, once again, it is not related to dissolution. That we know. But during the experimentation, let us say somebody is fresh to the tablet preparation. Somebody is very fresh to the nanoparticle preparation. And there are n number of experiments. I'm showing 4 only here. There are say 10, there may be 15. They want to segregate it into 2 parts, which is influencing, which is not influencing. So when you perform the DOI studies, one tool called as half normality plot, it will segregate the most influential experiments with the non-influential experiments. How it is selecting is, when you do the studies, it will have a plot. On the plot, what will happen is your talcum will come, the diluent will come, and whatever the other excipients which is not influencing the dissolution will pass on this line. Wherever the cross caramelized sodium, the magnesium stearate will fall above or below this line. So as the rule of thumb, what is the half normality plot indicates is anything which is falling above or below the lines are the most significant influencing excipients of the response, whereas whichever which is falling on the line, they will never influence the response. That is the use of the half normality plot. Did you got, sir, what I'm saying exactly?
Yes, sir. Clear, sir.
Yeah. And as another.
So once more, so
Yeah.
can we use the half normality plot as a part of filtering the factors also?
Yes, sir, of course. See, if you open the design of experiment software, any software, before going to the interpretation of the results, the first graph you'll get is half normality plot. That is a basic plot of interpretation. Once half normality plot finished only, then DOI will take to the next level. What are the factors which is influencing? The ANOVA will be calculated, the F factor will be calculated, all the calculations will come later. The first and foremost graph is the half normality plot. First you have to segregate. Otherwise, the number of experiments will be more and more. It will keep on increase. Is it okay, sir?
Yes, sir. Clear, sir. Thank you.
Yes, and Madam Vijayamma has raised the hand. Madam. Okay. So Anita, Madam has posed some questions. Generally in DOE, we will get some number of solutions. In that, which should be selected as optimized one? What is the role of desirability in that? Yes. So, Madam, actually, this is the question to be asked at the end of the, at the end of the practical which I'm showing you. That time, what happens is DOI will ask, the software will ask you, what is your desirability? Let us say my desire, my aim is to have 85% release. That time, based upon your desire, it will show some set of experiments, experiment number 1 to 20. It says experiment number 1 desirability is near to 1. That means if you take experiment number 1, you will get the whatever the value you want. Let us say 85% is your desired value, means there you will get exactly 85%. So there is no way related to the number of runs. The number of runs is fixed depending upon the what are the the design which you are taking. But whatever you're talking about desirability, it is at the end of the experimentation, and the term called optimization. When you're doing optimization, that time you are approaching the desirability value. There it will tell the software or the experimentation will tell you what exactly you want and what can be done further. Okay, that anyway are going to say with the experimentation. Any other questions? No, I didn't understand this question, Madam Varghese. Sir, about levels 2. What is exactly the question? I didn't understand. If you are there, you can open your mic and you can able to ask the question. Are you there? Okay. So let us, without wasting further more time, let me complete, the thing. Okay. Okay. So before going to the models, the final part in the presentation of models, we have to also understand the types of graphs which has been involved in the DOE. So what is the various types of graphs? We know until now our education, only one graph is called as the normal graph, right? X-axis, Y-axis, the 2-point slope, and also intercept. It may be sometimes positive, it may be sometimes goes negative. Okay, this is the things we know. But in the DOE, you have n number of graphs. The moment you download any article and all, you will feel frustrated sometimes to see what is this graphs and how to interpret it. And I want to say I have taken only the most significant graphs which will be used for the interpretation of DOE. There are few set of graphs only for the representation purpose. I didn't take it in order not to waste much time. So I'll just show the graphs in a glance. What is the graphs? First one is the perturbation plot. So you can see here the graphs. Once I can say all these graphs, please don't forget the basics, x-axis and y-axis only, nothing else. But the use and the how we are interpreting the values will change it. So on the x-axis, I have taken all the factors levels, that is minus level, minus, plus. I'm not talking about the true values, it is only the coded values. Now I have 3 factors, A, B, C. Now A, I'm increasing from minus level to plus level. Similarly, B, I'm increasing from minus level to plus level. C, I'm increasing from minus level to plus level. What is minus level, plus level? It is the values 5 mg, 10 mg, 2 mg, 3 mg. That means the least level which you have taken, the plus level which you have taken. That's why I said what is the advantage of DOE is you can know each and every increase in the value, what is happening to your response. It is a scientific correlation. But whereas in the OFAT experiments, least value, what is the, let us say, A at least value, what is the resolution? A is highest value, what is the value? This only you know, but what was happening in between these two, you don't know. And you cannot understand what was happening also. Okay, first plot, the perturbation plot is all factors. Let us have taken in this experiment 3 factors. When I'm increasing the value from their least level to plus level, what was happening to the resolution? Whatever is there here, global cell, let us forget about it. Just for understanding purpose, you understand. So you can see out of these 3 factors, factor A having significant influence on the response. How you can say that it is having more curvature? That means when you're increasing from minus to plus, the resolution also gradually increases from here to here. How much it is increased? Somewhere around 20 to near about 100. But whereas B, you can see it is little decreasing from 80 to 60. So if you see C, it's almost like nil. It is like standard. That means What is the perturbation plot is, in a single graph, you can see what is the influence of all the factors on my single response, but not many. Try to understand. It is only one response, like a dissolution you can see at a time, or disintegration you can see friability, but not all the response at a time you cannot see it. That is not possible. One response, but one n number of factors, you take 1000 factors also no problem. You can see at a time what is happening to the dissolution. That is a use of perturbation plots. When it comes to the counter plots, also called as outline or the boundary, the name indicates the counter means boundary. It is a boundary. Example is the boundary. So these plots basically displays a three-dimensional relationship in the two dimension. So what exactly it is, I'll tell you here. You take this graph as an example. You take nanoparticles, size nano. Okay. So what is the responses for nano? If you want to measure, I want to measure size. I want to measure entrapment efficiency. I want to measure some other like drug loading and all. Let us say this graph is only one response called as entrapment efficiency. I said before also, no graph can be used for more than seeing one response. Never it is possible. You can see n number of factors at a time, but only one response. That means 5 factors at a time I can see what is its role on one response. But all responses at a time I cannot see it. But you can able to correlate scientifically or through the mathematical equations. But in the graphical methods, we cannot do that. Okay. Now I want to see. I used a polymer called a lipid. It is a basically lipid nanoparticles, and I use surfactant. 2 excipients I have used. Now I want to see the role of these two in the entrapment efficiency. What is the meaning of entrapment efficiency? How much drug that has been stored in a nanoparticle. Right. So how I can correlate is, you can see there are different boundaries. As I said, counter means boundary. This is the darkest boundary, followed by the light green, still light green, almost light green. It is almost like a white, right? Boundary. So the darker the boundary, remember delegates, the darker the boundary, the higher the value is. So what is the response we are seeing here? Entrapment efficiency. That means this is the area where I can have highest entrapment efficiency. That means if I take lipids, this is the minus level of lipid, 350 mg. This is the plus level of the lipid, 475 mg. This is the minus level of surfactant. This is the plus level of surfactant. So if you could able to interpret, just extrapolate the line at 35 mg of surfactant and also at the 425 mg of lipid, I can have highest entrapment efficiency. But whereas at the 25 mg of lipid and also 350 mg of surfactant and 350 mg of lipid, I have least entrapment efficiency. So basically what is the meaning of counter plots is, you can see higher responses and lower responses. That is the only thing. Higher responses, darker regions, lower responses, lighter regions. That is the advantage. Even if you take dissolution as an example, if you take, this is the cross carbonyl sodium, this is the magnesium stearate. So here highest dissolution 90%. Whereas in the case of the least concentration of excipient surfactant, I can have only maybe 60% resolution. So the boundary indicates the range of responses. But since you have taken this from the Minitab software, Minitab use this kind of strategy. Whereas if you take Statis software, they will not use this kind of lines. They will use different colors. You can see red color, yellow color, green color, and blue color. Red color is the highest value range. Hope you can see here 100, 80, 60. So red color is highest, blue color is least. So basically, whatever it is, the counter, it says boundary. The boundary, as the boundary changes, the value changes. So what is the use of this boundaries is, you can able to extrapolate what range of my concentration of excipients, which kind of responses I get, higher responses or lower responses. That is the use of counter plots. Then next comes to the 3D plots. The name indicates 3D. Yes, Mary John, madam, please unmute yourself. Yes, thank you. So 3D plots, you can see the name itself indicates 3-dimensional. We know 2-dimensional means this is x-axis, this is y-axis. 2-dimensional. 3-dimensional means the third axis, z-axis, right? You can see in the same graph, this is one axis. This is let's see. Actually, I didn't give like this. No problem. This is y-axis, and this is a z-axis, the third dimension. That's why the name indicates 3-dimensional graphs. These are also called, as people used to say, fancy graphs. It looks very fancy than other graphs. Say, you can see how nicely it is like 3-dimensional. It is looking like a roof, right? So what is the advantage of these graphs is, once again, it is like a counter plots only. That means Let me explain with the example. I am taking response Z here. Okay, this is a response. Let us say it is a resolution. Excipient 1, excipient 2. You can see -5, +5, -5, +5. Now, when I'm increasing my first excipient from minus level to plus level, you can see at the beginning, the resolution is somewhere around mid-range. But what happens is when I'm increasing, the resolution is decreasing at the mid-level, that is 0 level. But once again, it is increasing, isn't it? Similarly, if you take Y, at the beginning, the resolution at the midway, it is increasing, but once again, it is decreasing. So the curvature, what is the main advantage of 3D graphs is you can see the curvatures. That means it doesn't mean, see, I'll tell you an example. Even I have also said in the OFAT experiments, you can see what is happening at the starting point and what is happening at the ending point. But in between, it may be ups and downs. It is not like calibration curve, you will get a straight line, right? So these curvatures will be missed in the OFAT experiments, because at what level of excipient, what is happening to my response can able to see by these graphs and DOIs. That is an example. There is advantage of this. So the curvature is deep. So the response is also varying from minus to plus. Sometimes the curvature is flat. I will show you. I'll tell you the example. See, you can see the curvature here. This is also 3D. So when they're increasing the surfactant concentration, the size is not changing. It remains same. But whereas when they're increasing the oil concentration, the global cell is drastically increasing. So it all depends upon the roof, how the roof is designed. The roof is flat, the roof is round, the roof is oval. So the curvature indicates how much influence the excipient on the response. The last graph is the counter overlay plots, are also called as the design space. So as I mentioned before, this is the design space, this yellow color. So as I said, DOI will never give an ideal batch. It will never say B5 is the best batch. No, it will only say a design space. What is the meaning of design space is, so as I mentioned before, if it is 85% is your target, if you work within this design space, you will get more than 85 for sure. It may be 86, 87, sometimes maybe 100, we don't know. That means definitely you will get more than 85. So you can see here, just concentration on this image. So I can put anywhere cursor here, then the DOI will show me how much I have to take X, how much I have to take Y, so that you will get 85%. Similarly, if I put the cursor here, once again, DOI will tell how much I have to take excipient concentration, so that I will get my dissolution different value. So that is the advantage of counter overlay plots. So there are other plots which I have shown before also. Half normality plot, what is the example? This cubic plot we are going to see when you are seeing the example of the experiment. Then the Pareto charts. So Pareto principle says all the factors are not significant, like how after half normality plot you will get Pareto plot. So the most significant factors they will write at the first, the non-significant factors they will write at the next. So let us say it is a dissolution. First excipient is influencing almost 80, remaining under nothing they're influencing. So they'll put an orderly manner. That means highest influencing to lowest influencing. So what is basically Pareto principle says is, out of 100% factors, if you take it, only 20% factors only really they're influencing the response, whereas 80% factors are just acting, they are not influencing the response. Let us say the example which before I have shown, only cross carbonyl sodium is influencing my dissolution, whereas other factors are nothing they're influencing. Maybe they're influencing the other responses, maybe the friability, the disintegration, but we are talking only about the one response here, right? So that is the Pareto principle. This is the perturbation plots, and this is the counter overlay plots. These are the different kinds of plots that can be used for the interpretation of graphs, right? So now I request the host. We have another 10 minutes. I have to discuss about this design, how this design has been built. So it will take another 15 to 20 minutes. Can I proceed, or what I have to do it?
Sir, please
sir. You can
proceed, sir.
I can proceed, right?
Yes, continue, sir.
Yes, sir. So I don't mind. I'll take another 15 minutes. I'll finish it off. Then what are the doubts they're having? Just put it on me. We'll clarify with the doubts.
Okay, sir.
Yeah. Okay. So when it comes to the most important and the core topic of the the DOI, even I can challenge many other places. Nobody will explain you how to choose a model and how this model has been built. right? Because even in the textbooks, if you go and search DOE textbooks, you will not find this answer. You concentrate more, and if possible, you have a white notepad and pen. You please try to plot the models which I'm showing here. So before going to the models, how to conduct an experiment, how to conduct a DOE is, there are 8 steps in the conducting of a successful DOE. The first step is define your objective. I will tell each with example. My objective is 85% of release. My drug should be released 85% in not less than 15 minutes. That is my objective. Okay. Now define factors and ranges. Now I have to take for this resolution a super disintegrant, a diluent, a glidant, or whatever it is. So many things I have to take. Now I have to take the factors and the ranges. What is the minus level? What is the plus level? That is the second step. Now define the responses, whatever you want to study. Apart from the dissolution, I want to study the disintegration. I want to study the friability. I want to see the flow property or whatever it is. Whatever the other responses you want to study. Then you find out the suitable design to do it, because there are so many experimental designs are there. What experiment fits for you with the what is the objective you are having, you have to design this experiment. That is what our next few slides which are going to discuss. Then perform the experiments. After design, after selecting the design, it will give some set of runs like 5, 7, 8, how many runs you have to perform. You have to do the experiment. Doing experiment means you have to prepare in the tablet. Let us say 8 runs means 8 different tablets you have to prepare and collect the data. That means you do the dissolution, you do disintegration, friability, everything do it. Then you have to analyze and interpret the data. How you are analyzing and interpreting the data? Just now you have seen the graphs or even ANOVA or even other statistical terms. You just interpret the data and confirm the result. That means once again DOE will tell you a desirable formula. What you have to do is you have to take that formula and once again you have to do it. See, try to understand doing the 8 experiments given by the DOE is not the ending. Once again you have to validate whether whatever the DOE is giving the correct values or not. After giving the ideal space or ideal desirable formula, you have to go and check it, and the percentage deviation, the percentage error should not be more than 5%. That means DOE is saying you take one formula, you will get 85% release. Okay, and you're definitely may not get exactly 85%, sometimes 84, sometimes 86. Now this deviation should not be more than 5%. There is a calculation for that, like actual minus predicted by predicted into 100. So you have to validate, confirm and verify the data. And if necessary, sometimes you have to perform some more trials to have more accuracy or more data. So these are the 8 different stages how you can able to perform the DOE. Let us move on to the last topics of the today's session. How to select a design. So many people ask this question, how to select the design and what is the differences between each design and all those things. Try to understand, in many textbooks, they will say different classifications, but the most accepted and the most understandable classification is this. Design of experiments has been classified into 2 types. One is screening designs, another one is the optimization designs. So what is the meaning of screening designs? Let us say you have went to the company, otherwise some students have came to you and you assigned a job called, you prepare some tablet, you take some excipients. Now the students was not aware, what is the excipients nature, what is the ranges to be selected, let us say how many excipients have to take. So what they will do is they will make tentative formula by taking some 10 excipients, but we know all 10 excipients are not influencing the response. So as a mentor, let us, I am also don't know, because my expertise in nanoparticles, I don't know about tablets. What I'll do to the students is, I'll ask the students is, you perform screening designs. Screening designs will screen out of this 10 excipients. Let us say 5 excipients is really influencing the resolution, remaining is not influencing, so that we can avoid. Try to understand, screening designs will segregate that factors into 2 types. One is the significant factors with that of non-significant factors. The main is the screening designs is to differentiate the significant and non-significant factors, that we have to very much important. See, please try to understand, many of the people, when they want to do DOE, straight away they'll open the software and they'll put the values. That is not the way. We have to do a lot of preliminary literature search. From that you have to select the excipients. From that you have to select the ranges. Because if you are not selecting the ranges, and if you start blindly the DOE will tell you it is a not significant model. The model, maybe the model which you take full factorial, the model which you take 3 factorial, it will show that the first result is, it will tell you the model is not significant. That's all. You cannot proceed anywhere. That experiment itself wrong. Why it is saying the model is insignificant? The levels which you are taking for the each factor should be very proper. As I said, they should have confidence level of 95%. Then only you can take it. But in that case, sometimes if you say, sir, I don't have the knowledge on the levels, the range and everything, what you can see blindly can go take to the screening designs. Screening designs will tell you what are the significant levels, significant factors, then that of non-significant factors. Then taking these significant factors, the 5, you can now perform the optimization designs to further optimize what better results you can able to get. So that is based upon that there are 2 designs. One is screening designs, another one is the optimization designs. You can see here the write up. Screening designs helps in identifying the most important factors that is related to the chemicals or that is related to the process, that is the compression speed or whatever it is that can influence the quality of the product. Here the quality of the product, once again I'm saying, it's maybe dissolution, disintegration or whatever it is. Whereas in the case of optimization designs, the factors which you are saying the most influential from the screening designs, that will be further studied and optimized to get the better desirability, to get the better outcome. So once again, screening designs are 3 types: full factorial, fractional factorial, Plackman-Bourbon. Whereas the optimization designs are 3 types: 3-level, central composite design or box making designs. Okay, and you remember one thing, in the pharmaceutical sector we are not bothering about these 2. Let us strike off this. We can ask me the reason why, because there are 2 things we have to discuss here. Always remember this fractional factorial or full factorial Plackman. What is the difference between these 2 is it will omit some experiment. Let us say 2 to the power 3 will give you 8 terms in full factorial. Okay. Now, if you take fractional factorial, it's like some fraction, it's going to omit it. 2 to the power 3 minus 1 is 2 to the power 2. That means in fractional factorial, you get only 4 runs. Where is the remaining 4 runs? It has been omitted. That we are calling scientifically as Eliased. Eliased means omitted. Like in engineering and all, they have n number of factors, sometimes 50 factors, sometimes 60 factors. They don't want to study all those things. They want to omit some of the factors that they'll give option to the design of experiments. They will omit the factors, fractional factorial or Plackman-Bourbon. But in the case of in the pharmaceutical sector, we cannot omit any factors because every factor Bourbon. If you want to, I want to say that interactions they will never see in Plackman-Bourbon. Directly they will see main effects. Let us say A, B, C. I have 3 factors. What is the interaction? I can study possible interactions between A and B, B and C, C and D, and ABC. This is the possible interactions, right? But in the Plackman-Bourbon, you cannot go with this. It will omit all the interaction effects based upon the model designed by the scientist. That's why I said if you have so many factors, you can able to go with, nobody will prefer full factorial, they will go with fractional factorial, Plackman-Bourbon. But in our pharmaceutical sector is concerned, we have only maximum of 10 excipients. Another 5 process parameters are hardly not more than 20. So we'll never go with full factorial Plackman-Bourbon. So I'm not going to bother about this much. Only we are going to see full factorial, 3-level, central composite and box making design. So based upon this, so this is how, if you put in the Google images, just put the design of experiments, you will get like these cubes, all cubes. These are all cubes. Only difference is the dots where are putting, the dots makes the design. So each design was built up by the one scientist by hard working of so many years. Let us discuss how this models has been built on the cubes. Right. So for this, the basics first we have to learn, right? So how to learn, we will see. So before that, I missed this slide actually to show you all. I think somewhere it is here, the slide. Yes. Any design, this is the way to identify the number of factors and trans. We used to write like this, 2 to the power 3. This indicates the level of each factor. So there are starts from like 2 levels, that is 0 plus and minus, 3 levels, sometimes more than 3 levels, that is minus 0 plus and minus alpha plus alpha, 5 levels. So basically this down indicates the level of each factor, and the numerator, the upper component indicates the number of factors you have taken. So if you take this run, it indicates you have taken total 3 factors, A, B, C, And each factor you are studying at 2 levels. That is, A is at minus plus, B is at minus plus, and C is at minus plus. That means how many runs you will get? 2 to the power 3 is equal to 6 runs. We will see how these 6 runs are coming. Okay. Right. So I am taking now a 2 to the power 2 design. That means A and B. I have two factors. Two factors, let us say cross carbonyl sodium, magnesium stearate. Which, see, why beginning from, don't mistake me why I am using cross carbonyl sodium, magnesium stearate, because that is how I can able to correlate each and every slide. But each and every slide, if I am giving different examples, you will confuse it. That's why from beginning I am giving only these two examples. So I have taken two. I am preparing a tablet. I am using a 2 to the power 2 model. I am taking two factors. One is CCS, another is magnesium stearate. So I am taking a simple basic model, which is at 2 levels. That means 2 levels, 2 factors. You will get 4 runs. How we are getting 4 runs, we will see. Factor A, factor B. How many runs? 1, 2, 3, 4. So what is the possible combinations? How 4 runs is? This is the maximum possible combinations. What is the possible combinations? First tablet I will do, A is at plus level, B is at plus level. That means highest concentration of A I will take it, highest concentration of B I will take it. In the second run, I can take least concentration of both, minus level, minus level. In the third one, I will take one is at least concentration, one is at highest concentration. In the fourth one I will take at highest concentration, another one I will take at least concentration. Now you can see we have covered in all the ways. That means we are playing a game within a boundary. That means whatever happens to the response, we know because we are within the boundary. But if you see the albendazole example, nobody knows why we taken 12, why we taken 20, why other excipient is at 1 level, 2 level. That means randomly we are putting. You ask any student, anybody will tell the answer. They will say randomly I have given some values. So then where is the scientific correlation? So I know, for suppose, let us say, first one I got 85% resolution. Last one I got 80% resolution. Now I know because I am taking, maybe this is the reason. The least level of B is causing least resolution. The highest level of both A and B causing the highest resolution. Something like that. There is a scientific correlation. So that is the advantage of DOE. So if you could see here, so how this experimentation came, 4 experiment is, first experiment I will use A at high level, B at high level. Let us say A minus level is 5. That means 5 mg I am taking cross carbonyl, 10 mgs highest level. Let us say magnesium stearate 1 mg, 2 mg minus level, highest level. Let us put these values here. So A plus, that is 10. This is 2. B is both minus means 5, 1. And minus and plus, A is minus how much? 5. B positive how much? 2. Similarly, A plus how much? 10. B minus how much? It is 1. So this is what I'm saying, that plus and minus. Hope it is confusing. Let us see here. Okay, this is for 3 factors. You'll confuse 1 second. Let me complete it 2 factor only. Plus plus, minus minus, minus plus, plus minus. Please don't misunderstand. This is not a game. It is a run. First run, second run, third run. Run is nothing but experiment which you have to perform. That means DO is giving you this experiment to perform. After performing, you have to give the values. It may be dissolution or disintegration to the DOE. Then it will interpret. Okay. So A plus means 10. B plus means 2. A minus means 5. B minus means 1. So A minus means 5. B minus means B plus means 2. A plus means 10, B minus means 1. So all the possible combinations you are going to study, and the DOI will give the results. Then you can able to interpret the desirability, whatever you are saying, that all will come. Let us take 2 to the power 3 factor. That means once again the level set 2, minus and plus, but there are 3 factors. Now what is the extra factor? A, B, C. You can see in this table A, B, C, 3 factors. Now first run will be all at positive levels. The last run will be all at negative levels. The remaining runs you see how nicely arranged: positive, positive, negative, positive, negative, 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 positive, positive, negative, positive, and positive, or minus, plus, minus, plus, minus, plus. And if you can show any other extra 1 run, you will become the scientist. But it's not possible, right? This is 2 to the power 3. The maximum combinations is this. And similarly, 2 to the power 4, whatever you take it, there is a scientific correlation and logic for an experimentation to do, right? If I take 3 XCPMs with 2 ranges, this is the maximum possible experiments. More than that, I cannot do it. So that is how this model has been built. Okay, let us come to the factorial designs and how this model has been built. Now, what I want to say is, I want to put it in a graph. Before telling the model how this model comes is, I want to put it in a graph. Let us say x-axis and y-axis. Okay. Now instead of x, so x-axis, let us say you take 0, alpha. Y-axis once, alpha means infinity, we don't know. Just I'm saying as a general purpose. Let us say it may be 10, 20 or whatever it is depending on the experiment. Similarly, y responds 0 to alpha. This is the usual graph we know. Now, the same graph I want to use to build this model. Instead of x, I'm taking A. Instead of y, I'm taking B. But I cannot write 0 to alpha because I have fixed number of values. A is at minus level, B is at plus level. Hope you're understanding. I cannot write 0 and alpha. I don't have infinity number of excipient concentration. I have taken somewhere around 5, somewhere around 10. That is a maximum. Similarly, B minus level, B plus level. Now what I will do is I will make a mirror image of this graph, the other side. A is at minus level, B is at plus level. Similarly, B is at minus level, A is at plus level. Now you can see the the people who is watching this first experiment. See, this is also a mirror image of A, mirror image of B. Hope you understand what is mirror image. That means if A is at minus here also A is at minus. If A is at minus, A is at minus here also A is at minus. Similarly, if B is at minus here also B is at plus. Similarly, if B is minus here, B is minus here, B is positive, B is here. That's exactly mirror opposite way you are seeing the thing. Now, first one you can see A is at positive, B is at positive. Last one, if you see A is at negative, B is at negative. And if you see the third run, one is at positive, one is at negative. And the fourth run, another one is at positive, another one is at negative. This is how the model, the simple basic model has been built. Now what I want to do is, I want to now plot this graph because I have 3 factors. Now I'm plotting a 2 to the power 3 model for the factorial design. How it comes? We know simple basic graph A, B. Okay, now what is the third factor added? C. I have to plot the third plot, right? Third dimension C. Now A minus B plus, B minus B plus, C minus C plus. From this you try to plot a cube. How you plot a cube? As before we have seen, let us merge this. A minus A plus, B minus B plus. Now I'm plotting C. Sorry, I couldn't able to draw properly because if it is a board, we can do that properly. Make a cube. Right? Is it like looking like cube or something like crushed paper? Okay. So all tangential lines. So okay, not to trouble you much. What I'll do is the same cube I'm just plotting here. A. First I'll draw all A's. Minus, plus, A, minus, plus, A. All horizontal lines are A's. A, minus, plus. Now let us talk about B. B. Now all vertical lines are B. B minus, B plus, B minus, B plus, B minus, B plus, B minus, and B plus. Now what is the third factor left pending? C. Now all tangential lines are C. So this is a, see, please don't confuse how this minus came. So I am not simply putting, this is a horizontal line, right? If you take any axis, simple graph, this is x-axis and this is y-axis. This is x-axis and this is a y-axis. Always the starting point is 0, but we don't have 0. What is the thing starting point is for us? Minus. That is the least level. That's why minus here, minus here. Similarly for C also it is minus. Starting point minus, highest point plus. C starting here. So yes, C minus, C plus. Similarly here for the C tangential line, starting point C minus, C plus. Here also for the C starting point, this is C minus and C plus. Now you see, all things came. That means 4 A's, 4 B's and 4 C's for the 2 to the power 3. Now we know 2 to the power 3 will give how many runs? 1, 2, 3, 4, 5, 6, 7, 8 runs will give. So how this 8 runs? Let us see from the cube. How many runs? First run, all plus. Is it there? Yes. My first run is all plus. All minus. That means A is at minus level, B is at minus level, C is minus level. My last run came. Yes, good. You take any run. You take, let us say here. A is at minus, C is at plus, B is at plus. So where is A minus here? Here, this run. A is at minus, B is at plus, C is at plus. You take this point. Here, A is at plus, B is at plus, and C minus. That means AB plus plus, this one. A is at plus, B is at plus, and C is minus. Like that, you can see, you will get exactly 8 runs. You please count it once again if you want. 1, 2, 3, 4, 5, 6, 7, 8. Since a cube have 8 cubic points, you will get 8 different runs. That is how this model has been built and how we are seeing the experiment. That means this cube is nothing but your 8 different tablets have to prepare, and how you are preparing all the 8 tablets you are playing within this cube, within the ranges of ABC. Now you know what was happening now, how the resolution is increasing or decreasing, because you know what is the minimum level and what is the maximum level. That is the example of and an advantage of DOE within the design space, within the conformed experiments, within the limited experiments you are studying. You are not relying on trial and error. That is today I'll prepare 10 tablets, let me see, okay, tomorrow weather is good, tomorrow I'll prepare some other 10 tablets. You are not relying like that. You are playing the game within the court, within the boundary, so you can able to analyze the output results. So this is a simple basic factorial design. So because other designs definitely it will take another half an hour, which I don't want to trouble you now. It is all your wish. Let us have discussion era, otherwise we can continue. Both is fine for me. Let me open my video. Yeah. Any questions you can ask? I don't know if you want, we will continue in the tomorrow, so no problem. It's almost 1.
Thank you, sir. So now the session is open for the discussion.
Yeah.
So I think previously Ms. Bimi had asked you a question.
Yes, that's what I want to. I'm about to tell.
Yes.
So I think Bimi Varkish, you can now. I think maybe you have asked a very long back this question. Now after these slides, now you may understand what is minus and plus, right? Once again, because you may have asked this before starting the designs. Now after this design, especially seeing the cube, you may understand that. Okay.
Yeah, she's clear.
Okay. Okay. Thank you.
And now, sir, in our pharma field, if you consider, can we apply the DOE designs for conducting the animal studies?
Yes, sir. Every department can use that. Let us say you are studying an animal study. Let us say you prepared on tablet and you are studying some anti-cancer. So you divide animals into 5 groups. and you make an experimentation. One animal I'm giving blank, another animal I'm giving a drug 50 mg, another animal I'm giving drug that 150 mg, that you make minus and plus level, and you correlate. Here the response is not like dissolution and all, maybe reduction of cancer tumor size, and a reduction, otherwise increasing the death rate of increasing the survival rate of the animal. Like that your responses will change, but DOI remains same. Now here you can say significant result, like I have quoted in the beginning also, clinical trials, how they're using the same statistics at the end of the clinical trials between the blank, that is the placebo, and between the drug and between the innovator. They cannot simply saying, see here 10 patients are cured, here only 9 patients are cured. They cannot do like that. They're applying the p-value and they're saying, yes, with my tablet, with my generic drug, this many people have cured with the significant value of the 0.05, 0.01. So the statistics will be applied everywhere. It is not only the pharmaceutical domain, everywhere, and they're saying it is mandatory. I don't know how many of you have experienced this problem. When you submit an article, sometimes you will get a comment, what is the statistical tool you have used and what is the significant level you have used, the significant level you get these results. Like that comments also sometimes you will get. So without statistics you cannot do it, and DOI is applicable for everywhere.
Yeah, thank you, sir.
Yeah.
And even after conducting DOI experiments, further, do we need to conduct any of the statistical studies? Because in the DOI itself, we are showing the model is fit or not.
Yes.
If you want to conduct, if you want to compare some of the variables, we can go for a statistical study. No, that is only the requirement, right?
Yes, sir. Yeah.
Any further questions the participants can ask?
Okay, so that is the question in the chat box. Which software is will be using for the design of experiments. There are currently, if you see the Statis, which is given by the Systech company, and the Minitab, but it's all depends on you which software you like. See, most of the time if you see the literature, they will use Statis, and also the money is varying from Statis to the Minitab. You can use any software, but you have to familiar with only one software. Let us say I am using Statis. Sometimes I'll feel difficulty with Minitab. The people who use Minitab, they say is very easier than the Statis. So all the softwares will give similar types of results only. There is single values that will not going to differ because it is an inbuilt statistical tools. But once again, the software which you want to use, you all giving that free trials 1 month. You download the software and you try to see this Minitab and Statis, which one you are very much comfortable. You start using that same for your projects or whatever it is. But we cannot say in a single set which one is easier, which one is difficult. As I said, let us say we are conducting in the webinar on the Zoom, but some people like Google Meet. Even I don't like Google Meet because Google Meet we cannot control the people. In Zoom I can able to mute everybody, but in Google Meet I can't do that. So it depends on the individual what software you are liking it. Until unless you are not exploring to the software, you cannot able to say concurrently which one is best or not. Any other question from there? Yes, you want to check the synergism or some other work, but whatever it is, the single statistical tool it is only. It is going to tell it is significant or not. As I quoted in the beginning, when the student is performing a dissolution studies, innovator product and generic product, he is very happy. Let us say you ask the student to prepare a generic version. What student mindset, innovator product is showing 85%, then student will come, madam, I have got 87% with happiness. But there only can apply the statistics, whether that 87% is really significant or not. What is the confidence level? It is 95% significant, 96%, 99%. There only can use it. Let us say you're talking about synergism. The synergism is significant at what level? 95%, 99%, or 99.9%. Whatever that thing it is, the statistical tool remains same. It will only tell the confidence levels. The student is confident that 87% release is okay, very good. So how the confidence will come when you apply the statistical tools only. Any other questions they have posted here? Let me check from beginning. Generally in UI will get some elements. Okay, that's nice. Okay, I think in chat box there is no questions. If anything, you can put it to us. I'm very much happy to address that.
Okay, sir. So I think no further queries.
Yeah. Thank you, sir.
So I think in that case we can wind up, sir. So
Yeah,
I think I'm attending your second session today. Previously in the last seminar also I have attended, and each and every session is giving new knowledge and insight to me. And really it was a very nice session. And in many of the chat box also people are informed that it was a nice session. Okay. So on behalf of all the delegates and from various academic institutions and from the pharma industry, so I thank you for your insightful presentation, sir. And we are grateful for the time and effort you took to share your thoughts and experience with us. Thank you, Doctor. So participants, also please note, tomorrow we'll start the session sharply by 11 o'clock. And I thank all the delegates for their active participation. Okay, thank you, sir. Thank you. Have a nice day.
Yeah, thank you for the organizing committee for giving this opportunity, and all the delegates for your patience listening. We'll meet you tomorrow. Thank you once again.
We'll meet tomorrow, sir.
Yeah, thank you, sir.